Hi everyone, and welcome to the final webinar of our Open Dialogue series about the National Ombudsman Reporting System, or NORS. I'm Amity Overall-Labe, NORT Director, and our speakers today are Louise Ryan, Ombudsman Program Specialist, Administration on Aging, Administration for Community Living, and Maria Green, NORT Consultant. Today's discussion is about verification, disposition, referral, closing cases, and Ombudsman Program activities from Part 3 and 4 of the NORS training materials. As we did in the last two, we'll present a few slides as most of the webinar time is open for you to ask questions. Think of this as a drop-by event where you're not obligated to stay the entire time. Feel free to ask your question and stay on to listen to others, or you can drop off the call. As mentioned in the email that we sent earlier, it will be helpful to have the ACL NORS tables 1, 2, and 3 available while participating in today's discussion. There are links to the training materials in the chat box. Next slide, please. Today's agenda is going to be a little bit different, but we are going to include a few remarks from Louise Ryan with ACL, either coming up in a couple slides or at the end of the presentation, depending on when she can join. A brief overview of the basic elements for Part 3 and 4, time for discussion, and a reminder of available resources. We will review Part 3 first, then do questions specifically about Part 3 and have that open dialogue, and then review Part 4 and have an open dialogue after that. The slides and recording from today's webinar will be included on the website with these materials, and we'll send an email to all registrants with the link following the webinar. Next slide. As a reminder, attendees are muted, so you may ask questions by using the chat or question and answer feature on your screen. When you have a question, you can write it in the chat box anytime. That way you don't forget about it and we'll get to it. And feel free to use either the Q&A icon or the chat box, which are both located on the bottom of your screen. So if you scroll down with your mouse, those icons should pop up and you can just click on them. Next slide. So like I said, Louise is going to hop on at some point today, but it looks like she's not on yet, so we're going to go ahead and go forward with the slides for Part 3, and then she can join us later with some remarks. Thank you, Katie. I'm going to go ahead and pass the webinar to Maria, and she's going to provide us with a quick overview of Part 3 before the dialogue regarding the basic elements.
Hello, everyone. This is Maria Green. Katie, if you'll go to the next slide for us, please. So these should look very familiar to you. It's the NORS Training Part 3 document for verification, dispositions, referrals, and closing of the cases. And so the resources that are available to you through the NORC website include the basic principles, the quiz, a quiz and answer sheet, and then a little brief on closing the case, and you should see the link there to the website. And you probably remember, but we had, based on your comments from the prior webinars, there were 2 questions that we revised back in September. So when you look on the site, make sure that you are retrieving the quiz and quiz answer sheets from that September 2019 version, and that's noted in the footnote. Next slide. Okay, so we all know that the basic principles include verification, and that's just a confirmation that most or almost all of the facts alleged by the complainant were likely to be true or are likely to be true. And remember that each complaint in the data system must have a verification status of either verified or not verified. Next slide. So these are just some of the basic principles. You can see them there on the screen in front of you. But remember that ombudsmen should always attempt to determine the facts of the complaints as part of your investigation process. The ombudsman should investigate and work to resolve the complaint, as you know, on behalf of one or more of the residents for purposes of doing your work. Ombudsman must always support and maximize the resident participation in the process of resolving the complaint, and you must follow the direction of the resident. We all know, though, that there are times when the facts presented in the complaint cannot be verified. However, that doesn't mean that there wasn't a standard, that there isn't a standard of practice for the Ombudsman program. You should continue to do what you can do to see, look into the case. More often than not, there are steps that you can take to do your best to ensure that the resident feels like they've been heard or listened to, and that you can work towards their satisfaction of the resolution of the complaint. Let's see, next slide. So with the disposition, that's the final resolution or the outcome of the complaint investigation. You can perform a lot of activities, and I know you certainly do when working to resolve or investigate a complaint. But at the end of the day, when you're working in the data system, there's only one outcome per complaint. So each complaint must have a disposition code, whether the complaint is verified or not. Next slide. So you see on the right-hand side, the disposition codes are listed there. That's partially or fully resolved, withdrawn or no action needed, or 3, not resolved. So when you're choosing a disposition code, you should always follow the direction of the resident. There's a lot of guidance has been provided. It's available to you on the NORC website. But if the resident cannot communicate his or her satisfaction, you should always look to the resident's representative or to the complainant to determine if the resolution is consistent with what the rights and interests are of the resident. Next slide. So a little bit more information on if the resident cannot communicate. And down at the bottom there, you see the citations, the reference to the Ombudsman rule. When you're not able to communicate with the resident, you may rely, as I mentioned before, on the perspective of the resident representative, so long as you've got no reason to believe that that person would cause any harm or not act in the best interest of the resident. If the resident who can't communicate with you does not have a resident representative, then you as the Ombudsman shall determine whether the complaint was resolved to the satisfaction of the complainant. And then sadly, if the resident dies before the investigation is complete, the Ombudsman, once again, you can look back to that resident representative if there is one, and look to see if they feel that the complaint was resolved. And if there is no representative, or you don't feel that that representative was looking out for the best interest of the resident, then you, the Ombudsman, could determine the resolution. And all of this is based on requirements in the Ombudsman rule. If you want to look back at those, as I mentioned, those citations are there on the slide. Let's see. Let's go to the next one, Katie. So this is about referring things to other agencies. And for your reference there on the right-hand side are the different referral agencies that are listed. So every complaint that you have within a case must have a referral code, even if you end up using 99 other, maybe it wasn't something listed there that we've got, or it could be 06, no referral was made. And if need be, you can have more than one referral agency for one complaint. Okay, next slide. So for every case, you must have a closure date. So the system is going to seek for that verification. The system will look to see if you actually have put in a closure date. And probably most systems that you're using with vendors or through your state might give you a little reminder, hey, you've got to have a closure date for this before you can move on. Each complaint must have only one complaint closed date. And you can close the case after completion of all the actions on all the complaints within the case. And every complaint has to have a referral code, a verification, and a disposition code. So these are good tips even if you wanted to write yourself out little reminders that these are the things you got to check before you close a case, that would be helpful. Next slide. I believe I'll be turning it over to Amity. So if you've got questions, please put them in your chat box, and Amity and I will do our best to address them.
Thanks, Maria. All right, so please, as I instructed earlier, feel free to drop your questions into either the Q&A icon or the chat icon. And as of right now, we don't have any, so we will sit in the silence just for a little while and see if we have any questions come in. And while we're waiting, if I can, Katie, I'm going to try to share my screen, so just give me 1 second. Let's see if I can make this smaller.
Amity?
Yes.
There is one question that has come in. It wants to know if every case must have a referral code. So Amity, if you can go back a couple of screens where I was showing like 2 slides back, maybe there, right there. So even every complaint must have a referral code. So even if you didn't refer out to anywhere, you're still going to use code 06, no referral was made. I hope that answers the person's question, and if not, maybe they can write or seek a clarification in the chat box again for us.
Thank you. Good question. And I'm glad you caught that. I had my other screen up and couldn't see it, so thanks, Maria. All right, so we'll just keep on holding for a little bit in case some questions come to mind. And let me see. Katie, I'm going to go ahead and see if I can take over and share my screen just for a second. So let's see. Okay. Can you all see my screen? It has questions. It's the FAQ page of the website. Maria, can you see it?
Yes.
Okay, great. I just wanted to take a minute and remind you all where this is. There'll be some resource slides at the end of the presentation, but since we had some dead air, I thought I'd take advantage of it. On the website, you go to Support, click on NORS, and then this is where we have all of the revised NORS information, which obviously has been effective since October 1st. And if you scroll down to NORS FAQs, this is our FAQ landing page. We do have it available in PDF form, so in case you want to print it and keep it with you or use this version for training, it's really handy to have on hand. And then we also have the FAQs divided out by section. So there was actually one on referral that we received. Someone asked for referral agency codes. How do I code referrals to the OIG, the Office of Inspector General, Attorney General, or State Attorney or professional boards, such as Board of Nursing? Because this wasn't really outlined in Tables 1, at least specifically. So the answer would be using code 03, law enforcement or prosecutor for the OIG, AG, and State Attorney, and then use code 01 for licensing, regulatory, or certification for professional boards of licensing. So just wanted to let you know that that's available in case that question comes up. So there is a question, let's see. When I open a case and there's no referral made at that time, but as the investigation goes forward and a referral is appropriate, can we go back and change to the appropriate referral code at that time? So Maria, correct me if I'm wrong, because I know you've done a lot of more TA on actual software systems than I have in working with states, but it's my understanding that when you open a case in your software system, you can change information within that case until you close it. So if you're actively working that case and then you make a referral closer to the end of your work on that case before you close it out, then yeah, you should be able to say that you referred it out at that point and then close it out if that was the next step in your investigation process.
I agree. I think that's my understanding too of most of the software system.
Great, great. Okay, well, I'm going to stop sharing my screen for now and go back. Katie, I'm going to hit stop share, and then hopefully it'll go back to you. And we can go back to the slides. And just so you all know, the link that I mentioned earlier in the presentation is in the chat box that goes to the slides for today's presentation, and we will, again, send that out after the webinar as well. Seeing that we don't have any questions or messages in the chat, Maria, was there anything that you wanted to pinpoint from part 3 before we move forward? As we sit
Not
for a
that
bit?
I can think of right now. Thank you.
Sure, no problem. Oh, here's another one. Just 1 second before we go to the next slide. Okay, so this question is about coding. So if you don't mind, about complaint coding. That's going to take a little bit more time to dig because since today's session's on part 3 and 4, so give us a minute to look at that. Maria, I'm going to review the next part 4 slides if you can look up an answer to that question, and then we can go back to that in the next part of the open dialogue. And then another question we got is, if the facility staff makes a referral, do I enter this? So I'm not really sure of the entire context, but if you, I assume you're talking about if you're in the middle of working a case, then does that mean that you've encouraged, this is an assumption, maybe the case is involving abuse and you remind the facility of their responsibility to report that abuse or contact the licensing agency as well as law enforcement? I assume that's what you mean. And if so, and Maria, correct me if you think otherwise, but I wouldn't consider that a referral necessarily because the facility is simply fulfilling their responsibilities of reporting suspected abuse and a potential crime, and so they're following their requirements, and you as an advocate reminded them to do so. So I would not count that. I would count that as if you actually made that referral, so you're not getting anywhere with the facility and you think that it needs to go to licensing and the resident agrees and supports you doing so, and you make that referral, then you would count that and make a note about that in your case documentation. Maria, feel free to add. And I hope that answers your question.
I agree.
Okay, great. Good questions all. Thank you. All right, Katie, let's go ahead and move to the next part of today's training. So part 4, similar to part 3, we're just going to skim through some slides and give you some highlights and then have some time for questions and discussion. So with the part 4 training documents, there are 3 documents: basic principles, the quiz, and the quiz answers. The quiz covers sections S51 through S68 from ACL NORS Table 3. Just so you know, some of the answers, I assume that most of y'all have taken the quiz by now, but some of the answers in the quiz are pretty easy and obvious to code when entering that data into your software system. We did that intentionally to introduce some of the reporting data elements that are now being collected in this version of NORS, just to get folks used to it. NORS Table 3 contains information that the state ombudsman will complete on behalf of the program and submit as part of their NORS annual data submission to ACL. So that information isn't covered in the training materials, nor will we really dig into it today. Those pieces include complaint examples, systems issues, ombudsman program organizational structure, staffing and volunteer data, conflict of interest issues, budgeting, facility data elements, and state and local coordination activities. Just so you know, this information will be covered in great detail at another time, specifically with state ombudsman. And similar to part 3 and part 2, due to feedback from the webinar series we did earlier this year, we did make some revisions to the quiz. Questions 9, 10, and 13 were revised in September, and the answer to question 5 was revised because there was actually an error in October 2019. So please use the current versions that we have posted on the website. Next slide, please. As I just mentioned, most of the data elements in ACL Table 3 is compiled and written by the Office of the State Ombudsman, so we're only focusing on those activities that are most applicable to representatives of the office, those in the field. Also, just so you know, NORS doesn't capture all program activities, and this really isn't different. The previous version of NORS was the same way. They didn't capture everything that Ombudsman programs do. And so your state may choose to collect additional data on, for example, training or facility visits, survey participation, or participation in resident family councils and community education. And that's okay. It's just not collected nationally through the system. However, it is important that states need to determine how to document all of those extra activities in order to ensure that there's not duplication or overcounting. Next slide. So for basic principles regarding training, State Ombudsman will report 3 elements regarding training. And this is training specifically provided to representatives of the office. Certification training hours, so this would be the minimum number of total hours required of initial certification training for individuals to achieve certification, which would allow them to be eligible for designation as a representative of the office. And just for clarification, this means volunteers and staff, because they are the same, one and the same when you're talking about representatives of the office. For continuing education, states will report the number of annual hours of in-service training required for all representatives to maintain their designation. And then the third part would be the total number of individuals, again, paid or volunteer, completing the initial certification training within the federal fiscal year. So State Ombudsman, again, similar to what I discussed earlier, they may choose to collect more detailed training information from you, but those details wouldn't be reported in NORS, such as how many people attended the training, the type of the training, and the training topics. Next slide. So this slide is about training again, but this is training for facility staff provided by the Ombudsman program. And states will be required to report the number of total sessions conducted and the type of facility setting, so nursing facility or residential care community, based on the facility affiliation of most of the people participating in that training session. They also will report in-person training, each instance as a separate session, even if it's repeated at the same facility. So for example, when an ombudsman goes out and provides in-service training to a facility to 2 different shifts of staff, morning shift and afternoon shift, then that would count as 2 separate sessions. And another example, the program providing morning and afternoon resident rights training and assisted living provider conference over 2 days, that would be 4 sessions because there were 2 sessions over 2 days, so that would be 4, because again, you're counting the separate instances. Next slide. A little bit more about training, and this is new to NORS. They are now taking into account distance learning and really digging into what distance learning means. And that is simply webinar, online courses, conference calls, anything that's really not in person. So in order to report distance learning, there must be a way to track that participants completed the training as well as their facility affiliation. So regardless of the number of people that attended the training, a distance learning training program needs to track the completion numbers and facility affiliation, and that counts as 1 session. So for example, maybe a program has 2 online training programs about resident rights. One is for nursing facilities and the other is for residential care communities. Therefore, the content of each course is a little bit different because it's specific to the facility type. So the state would report 2 sessions in NORS, one under each facility type, provided that at least one person completed each online training program. So again, this kind of goes back to the other slide about not counting the number of attendees. You're really counting the number of these sessions that are available by facility. Next slide. So basic principles around facility visits. States are going to report 3 things about facility visits, and by reporting it this way, I think we're going to have a lot of really good data to get a feel for how often residents have access to the program in person. So for the first one, states will report the total number of nursing facilities or residential care community facilities that received at least one visit by a representative of the office during the entire reporting year, regardless of the purpose of the visit. The second part is they'll report the total number of all visits. So total number of all visits to nursing facility and residential care communities, no matter the purpose of that visit. And then thirdly, report the number of facilities that had a routine access visit. So what that means is it's the total number of nursing facilities and residential care community facilities visited in all 4 quarters by a representative that's not in response to a complaint. And that's not very different from the previous definition of routine access. Okay, next slide. Survey participation. This is a little bit different, and again, I think it's going to be more accurate in reflecting what representatives actually do in the field. You're now reporting each distinct type of survey activity as one instance by facility type. Excuse me. So for example, this includes participation in both the standard annual surveys and complaint surveys. Survey participation includes, but of course is not limited to, pre-survey information to surveyors that you provide, sharing complaint summary reports, participation in exit conferences, and informal dispute resolution. And you may actually have more than one survey participation associated with one survey in one facility. So, for example, and this happens a lot, a surveyor calls you prior to entering the building, and you provide information about what you've observed during your visits, the type of complaints that you've handled and whatnot, and maybe some concerns you have. And but you also attend the exit survey in person. So instead of how it was previously counted in the previous NORS, now you would count that as 2 instances of survey participation because you gave information once and already talked to them, and then you also attended the exit survey, which very likely in that situation you not only learned, what happened in that survey, but maybe you provided some follow-up and spoke with them again at that time. So that would count as 2 separate instances at one facility in one survey. Next slide. Thank you. So this is about resident council and family council participation. Similar to the surveys, you're going to report each distinct type of council participation as one instance by facility type. And participation could include meeting with council leadership, providing training to the council members, and attending a council meeting. But there are some important tips that you need to keep in mind when you're trying to figure out how to document your activities. If you're providing technical support or technical assistance, consultation, or information to a resident council or family council outside of an actual council meeting, you would report that as that activity as providing information and assistance, which is S55. Also, if 2 ombudsmen, so for example, maybe you're training a new volunteer, so you bring them to the council meeting, or 2 volunteers are budding together and visiting together, that would only be reported as one instance of council participation. So even though 2 people were there, it's just one instance of participation. Next slide. And community education, again, you would report each instance of community education outreach sessions by Ombudsman. And you would use you'd use community education as an activity for attendance at health fairs, community events, general presentations. Just so you know, the number of individuals, similar to the training we mentioned earlier, attending the community education event is not collected in NORS. If a community education session is provided by distance learning, similar to the training, you need to have a way to track that the participants actually completed the session in order to report it as a session in NORS. Newsletters, blogs, and other forms of media do not count as community education because there's no way of guaranteeing really that anyone reads that information and no way to track it. And if 2 ombudsmen participate in the same community education event, again, it counts as one instance similar to the councils and other activities. So I know that was a lot of information over a few slides very quickly, but we just wanted to give some high-level reminders of what Part 4 includes. So next slide, please. And now we have time for the open dialogue. So Maria, I see that you answered a question or said you were going to answer a question live. Do you want me to respond, or are you going to?
You can go ahead. I was going to type it in, and then I pressed the wrong
gotcha.
button. So
no problem.
Show them.
That's fine. That was the first time I've seen that too, so thanks. So the question was, will this PowerPoint be available to you? Yes, it will. As soon as we get it posted on the website, we will send out an email to everyone that registered, and it'll include a link to where you can find this information. And just so you know, I'm going to try to share my screen again, Katie. Let's see. Okay, just so you know where you can find that, even if maybe you don't get the email and it's stuck in your junk mail folder or something. If you go to support, go down to NORS, go down to the very last bullet right here, NORS FAQ and TA Open Dialogue webinars. You'll find the webinar we did about the FAQs in September, as well as all the Open Dialogue webinars, the slides and the recording. So just wanted to show you where that was. Thank you. Okay, giving it back to you, Katie. So a question was, how do I enter training for residents regarding resident rights? So let's see. That would go back to, and we don't have to go back to that slide, but that would be community education, providing community education information, unless, let's see, unless you're providing that information to a group of residents at the resident council meeting, then that could be a resident council activity, because that definition of participation includes providing training to the council. So it really depends. This is just my personal opinion from working in the field. When you would go and give a presentation to a group of residents, it was very likely that most of the residents that showed up to that training were part of the resident council. So I think that it makes perfect sense to count that as participation in a resident council because you provided training. And frankly, all residents, whether they go to the resident council meetings or not, are technically members of the resident council just by default. So Maria, feel free to jump in if you disagree or want to add to that.
Nope, I agree. And when you feel it's appropriate, I have done my research on the question that was asked earlier.
Oh, great. Let me check.
But I don't want to distract from discussion of questions regarding Table 3.
No, I think you're fine to go with that now. I'll read it out loud and then let you answer it, and we'll give some time for folks to enter more questions into the chat or the Q&A. So the question was about complaint coding. In the previous version of NORS, a resident that maybe had some issues with capacity that hit another resident was coded as I-66 for, I believe, if I remember, I think that was resident conflict or something like that. Should it now be coded as G03 or code A section? So go ahead, Maria.
Okay. So this was an excellent question because what it caused me to do, and I would assume, and I've been doing this for a long time now, but I'm assuming the others may go through the same thing. I went first to the cheat sheet, the one page, and I looked at G03, which is conflict resolution, includes disagreement between residents where assistance from the Ombudsman program is required. And then I looked at A1, which is physical abuse. Well, I didn't feel like it quite answered my question, so then I went to the cheat sheet that had a little bit more detail where we give examples. That was helpful, but then I took the next step and I went to the NORS curriculum for part 2. So I actually used 3 of our resources to come up with what I think is the answer. So in the examples for physical abuse, it talks about willful or intentional use of physical force. So in this hypothetical situation, there was a resident who has confusion or cognitive or dementia problem, whatever, that has struck another resident. So I would think your investigation would need to include trying to find out if you felt that the person with dementia was being intentional or willful in using physical force. If they were, maybe it's been an ongoing history, or maybe this resident has a history of striking other people, then it may be most appropriate to code it as A1 physical abuse. And in this hypothetical situation, that resident that was striking the other one would be identified as the alleged perpetrator. Now, if you felt like there really was no intention or willful aggression, then I certainly think you could find a reason to code it as G3 conflict resolution, because there was a disagreement between the residents and it just maybe got out of hand. So it's a prime example of where it's not always really black and white which code you would use, but using your investigative skills, and when you're interviewing the resident, maybe you're talking to other staff, maybe you're talking to family, you find out more information that might help you decide how to best code this particular complaint. Amity, feel free to give any response that you might think.
No, I don't have anything to add, and thanks so much for walking everyone through your thought process. I think that was great and very helpful, and a good question, one that we've actually received a few times. So I don't think we have an FAQ about that yet, so maybe that will be on our next phase. So thank you for asking that question. We received another one about visits, and we received this quite a bit too, so I want to show you something in a moment, but about facility visits, both routine and non-routine. If an ombudsman goes into a facility because they received a complaint and want to speak with the resident, but while they're there, they also speak with other residents, would this no longer be considered non-routine or complaint-based rather than routine? And does that mean the intent of the visit is no longer determining how we document the visit? Excellent question. So I'm going to share my screen. Give me one moment. Hopefully most of you joined the initial webinar series we did earlier this year on these training materials. And as we shared with you at that time, we listened to your comments and questions and concerns, and over the following months and weeks, we made some changes to the materials, and one of which was how we responded to the question about visits. As you may remember from the past, your visit was documented based on the original intent of the visit. So, but after really talking to you all and thinking about reflecting the reality of what happens in the field, we felt that it was best to document the visit as either a complaint visit or a routine access visit based on what you did during the visit instead of the initial reason for that visit. So, for example, what would happen to a lot of programs, especially those that have to drive a long time to visit a facility, you'd receive a complaint, you'd drive an hour, maybe two or longer to that facility, and then you would, of course, follow up with that resident about the complaint that you received. But while you're there, you probably walked around the facility, spoke with other residents, maybe talked to the resident council president, talked to facility staff, perhaps about the complaint, but maybe not, maybe about other things that you observed while you were there. And you did a lot of things that would be considered part of a routine access visit. You provided access to those residents to the Ombudsman program. You observed things, you spent a lot of quality time with residents in that facility. So we felt that it made more sense to be able to document that as a as a routine access visit opposed to just a complaint visit because you did more. Now, if you get a call about a complaint, you go to the facility and all you do is talk to the resident that's involved in that complaint and the staff about that complaint, then that would solely be a complaint visit if that was all you did during that visit was deal with that complaint. So I wanted to share that in the FAQs, we actually have this question and answer outlined here for you. So feel free to use this in training representatives and responding to this question because I'm sure you'll get it from your representatives as they document their work as well. So thank you. Good question, and I hope that helped. Okay. With that, I don't see any other questions, but we can hang on for a few more minutes to see if any come in. And Maria, if there's anything else you wanted to add, that would be great. Okay. All right. So,
Amity, if you're able to, just in case you haven't seen my note, Louise would like to join in. Okay.
Yeah, I don't have a pin. The panelists, they get a specific link, so that's what I was trying to figure out. Okay. Thank you.
So for the attendees, just so you know, Louise is trying to jump on and say hello, and if we can work that out, she'll be glad to join us. I'm so glad to see that there were so many attendees today, and glad that especially this late in the year.
So I see Louise is on now. Louise, can you say something and see if you're off of mute? Because I don't have the controls to unmute you. It doesn't say that you're on the, there we go.
Hi, this is Louise.
Great. Go for it. Thanks for joining us.
Is this a good time?
This is a good time.
I'm in the dark here.
No, you're fine. We just wrapped up answering questions about part 4, and we're just hanging in to see if anyone has any other questions. So this would be a good time for some remarks.
Great. Well, hi, this is Louise Ryan from the Administration for Community Living, Administration on Aging, and I just want to thank you all for participating in these webinars, and I hope you found them informative and that they will help you as you adjust to these new NORS codes. I'd say I've been getting, in general, feedback that it's going pretty well, and that the codes are making sense to people is the general feedback that I've received, and I appreciate that. But certainly, if you are struggling in some way, let the Resource Center know. Also, keep in mind that this is our first big overhaul of the NORS codes, and we will kind of tweak them later on in 2021, which means that I need to start planning that later in the year 2020. So we're collecting ideas, no more major overhaul, but looking at maybe there's some improvements to definitions, or, as we look at the data as it starts to come in, we might see that we really missed something that we need to add back in, or, so again, we're not going to do a big overhaul, but I will keep kind of a running list of suggestions and ideas. And again, I always say this, and so I'll say it one more time. When it comes down to it, the important things that you document, and you might be struggling between one code or another, but what's most important, and I'm sorry for the background noise, what's most important is that you document it and enter it into your software system, because we are very reliant on with the new system that, the states, the ombudsman programs will have to upload their data into a format and then upload it into our OEPS system. So if you didn't enter it into your software system, it will not count. So that, again, I can't say that enough. And I know documentation is hard. I've been there. Do your best to, set up routines where you set time aside every week or even every day, whatever works for you, but frequently and consistently to get that data entered. So with that, I think I don't think I have anything else to say other than, again, thank you. And in whatever way you might celebrate the holidays, please enjoy them, and Happy New Year. And I really look forward to seeing what this data looks like and how powerful it will be. And I don't know if any of you saw, there was recently a NBC story on improper evictions in which they used your data and also talked to a local ombudsman. And that's the power of your data, that it's spreading the word. And, we want to support that. So thank you again. And I'm going to turn it back to Amity.
Thanks so much, Louise, for joining us and for your comments, and for bringing up that article. So just so you know, if you haven't seen that, it's on the NORC homepage under News and Press. There's an excellent written article, but as she mentioned, there's also a short, 15-minute kind of mini documentary that follows some specific cases and interviews a local ombudsman from California. So check that out. That definitely shows how important it is to document your work. So thank you. All right. I don't see any other comments or questions, so I'm going to go ahead and move through our resource slides and remind you all as we're doing that as questions arise and we're still on the line, feel free to put them in. Okay. Thanks, Katie. So I already showed you my website by sharing my screen, or our website by sharing my screen, but just wanted to remind you that this is the URL that you'd use to get to that page, and you'll see little notes about whether something's new or revised, so just keep checking back on the website. We do not plan, just so you know, on making any other changes to the training materials. So those should be the final revisions until the ACL NORS tables expire in 2021. And as Louise mentioned, this is a new system. We're learning as we go in some ways, and we are finding things that could already be improved upon. So we are open to suggestions. So suggestions and input from you in the field are really invaluable. So as you work with the system, feel free to contact us and share some tweaks that you'd like to see either in the training materials, or if you find things in the tables, or really anything related to NORS, and we'll put them on our parking lot list of things to consider for future changes. All right, next slide. And this is the URL to the FAQ page that I shared earlier. And we do intend on creating more FAQs as time goes on and folks get more used to the new NORS. So if you have any questions that you think we should include as an FAQ to help your peers, then please send them to us as well, and we will work on that. Next slide. Again, questions, comments, suggestions, we are open to them. So today we heard from Louise Ryan from ACL, and thank you, Maria, for your presentation. We reviewed the basics of Part 3 and 4, responded to some of your questions, and reminded you of what resources are available. So please refer to the materials on the website and consult with your supervisor and/or state ombudsman as you have questions when you're documenting your work. However, we are also available for technical assistance. So do not hesitate to contact us with questions or, again, like I said, suggestions for future FAQs or changes in the materials or tables. Your questions and examples really help us improve our technical assistance. So keep them coming. And next slide, you may wonder how to contact us. Here's our contact information. So, and you should be able to find my email on the NORC website as well. So don't hesitate to reach out, call, or email. And next slide. And last but not least, wanted to share our URL. We do have Facebook page, Twitter, and then our new app. So if you haven't downloaded the app yet, please do so. It was intended to provide representatives of the office in the field with some quick information that you may need during your visits. So again, thank you all for joining us today. We really appreciate it. And thank you for the questions and for being engaged. Thanks to Maria for presenting and Louise for your remarks. Really hope that everyone has a nice break and some time over the holiday season. Please complete the brief evaluation that will pop up as soon as the webinar ends, because we always appreciate your feedback, and that's how we learn and grow. So thank you all for doing the important work you do, and have a great rest of 2019. Thank you much.
Thank you, Amity and Maria.
Thank you all.
And
Happy holidays.
Yep. Take care.
Okay. Bye-bye.
Bye.